Hello and welcome back to Doodles MD, where you get simplified medical information in relatable and applicable format. I am back this week, your host, Folake Lawal, public health, internal medicine, infectious diseases physician, and back this week talking about laryngitis. Before we start, make sure you subscribe to our channel, click the subscribe button. And laryngitis is the inflammation of the larynx, which is the voice box, and it's somewhere around here, I guess, but it's the covering that separates, the upper part of our airway and the lower part. So the trachea, the windpipe, starts from below the voice box, and it's two folds. I'll try to show a picture below, that open and closes as we talk. As you move, it opens for air to move in and out, and it opens when you're talking. So here there can be inflammation of those two cords and that area, and that's what we call pharyngitis. Because it affects, it's what helps us make sound, really. Your voice, you can lose your voice if you have laryngitis, or your voice can change because the movement also and everything is altered when you have inflammation or infection of the larynx. And it causes pain when talking, or just constant throat pain even when people are not talking, and sometimes during swallowing. So what are the causes of laryngitis? Again, most common cause, viruses. Everybody's always asking for antibiotics. Viruses wreak more havoc than bacteria. But again, most common cause is viruses. Rarely you can have a bacterial cause, or you can have a fungal cause, and this is really, really rare. Other causes can also be from smoking, from inhaling intoxicants, or inhaling fumes that are just irritants. Poor vocal hygiene, especially in people who use their voice a lot, singers, speakers, and that's why you hear singers talking about their doctors are putting them on arrest and things like that. They can't talk for weeks, they cancel tours. That is a real thing. Okay, so there's inflammation, and so when they overuse, voice abuse, voice overuse, voice misuse, dehydration can cause that. When people have also maybe sinus infection or sinus drainage that comes there, or they have acid reflux from the stomach and the throat, the windpipe, the esophagus, when they have acid reflux and it keeps spilling onto the voice box or the larynx, then they can also have inflammation of that area. Another cause is autoimmune diseases like Wegener's disease, polyangiitis, granulomatosis with polyangiitis. You can have that. We talked about irritants from acid reflux, irritants from smoking and inhaling other toxic fumes. Sore throats, dry throats can also cause laryngitis. Signs and symptoms mainly is change or loss of voice that lasts more than 7 days. So lasts between 7 to 10 days is laryngitis. And many times you also probably would need to come to, go to your physician's office to get checked out, because if it's caused by something that's serious, and especially when people really use their voice, then it could be something that really needs to be intervened. And when, of course, your doctor looks at it and they're able to determine the cause, that is very important in being able to differentiate the cause, and that would determine the line of treatment or the course of treatment based on what they determine is the cause or the problem. They investigate appropriately and they develop a treatment plan that is specific to your case. In some cases, of course, medication may be required, like antibiotics, if in the rare case that it's an infection, bacterial infection. Also, steroids can be prescribed in some people where they just want to calm down the inflammation. However, long-term use of steroids is definitely not recommended. It's usually for a short term, and it's going to be determined by your doctor or your health provider. For people, again, depending on where, you know, which category you fall on, or for people who use their voice a lot, voice therapy might be necessary for some people, especially, you know, especially singers, where they teach them how to do certain things so that they don't do it the wrong way and keep damaging their voice. Of course, if we determine that you have certain exposures that can be removed, like irritants, tobacco products, smoke, inhaling just stuff, or acid reflux, like I talked about before, you definitely want to avoid those things that you can avoid, and then those things that, you know, causing it, like acid reflux, find a solution to that. And this reminds me, there's a Nigerian artist who, you know, shared his story, and he was saying he couldn't sing for a long time. They were trying to figure out what was wrong, and eventually they realized he was having acid reflux. And his case was actually so serious, medication wasn't working. They had to do like a sort of advanced thing where they put magnets in the lower part of his esophagus to be able to close it and prevent the reflux. So acid reflux is serious business. So again, that's it for this week. That was short and quick. Laryngitis. Next week, I'm going to talk about sinusitis. A lot of people have it, a lot of people complain about it, and we'll just touch on that next week. Thank you for tuning in. Share your thoughts and your questions on today's episode. Please share with your family and friends. Follow us on our social media handles. And of course, make sure you subscribe to our channel. Till next week, I'm Falake Lawal, signing out on Doodles MD.